Okay, here we are back in the lab again. Well, we've had a lot of questions and people asking about the process of refreshing Flowcast and the finalization procedure. It just so happens that I have a patient that's in the middle of wearing her Flowcasted diagnostic or provisional dentures with bite blocks, and this Flowcast has been in this denture, would we say, since November? 2 months, and this is January. And part of the reason she has worn this for so long is we have really struggled getting the teeth in the right position. She was biting her lip, and if you'll notice, we've had to modify the bite blocks to get the vertical right. But this is the reason you do a provisional denture. She now is comfortable. If you look at the Flowcast, it still looks pretty good. She's been taking good care of it. If you look at that lower, we've got the S curve built in. But I will say this, it's getting a little dried out. And so this is the perfect time to refresh the Flowcast. Prior to refreshing it, the first thing you're going to do is you're going to put these into a flask, a line duplicating flask. And the reason we're going to do that is we're going to make this patient a set of duplicates of her provisional denture to wear while we're finalizing. Why don't we refresh it before we put it into the flask? You don't want to flask fresh Flowcast. So we're going to flask it like it is right now. And let me show you, we've already put it in a flask. I'm going to grab one right here. And what we did is we mixed putty, and we did one side. We let it set. We put some Vaseline. Then we did the other side and opened it up. So what we have is a record of her provisional denture that we can create an exact duplicate of that will serve her so she can wear it while we're finalizing, but it'll also be her spare denture. And what's great about a spare denture is if she drops and breaks a tooth, if something happens to it and we have to repair it, she has a spare she can put in her mouth and we don't have to rush. Suppose we want to reline her denture down the road. Well, she's got a spare in her freezer that she can just pull out and wear, and we can take all the time we want to reline it later on, say 2, 3, 4 years from now. I can't tell you how nice it is over the last almost 40 years of practice for all of my dentures patients to have a spare. I never have to get in a rush to fix anything. So this is what that flask will look like. You're going to flask it first and just put that aside. We can make a duplicate between now and when she comes back to finalize. So the process of refreshing the Flowcast, we put it in the jig. Now we can go step by step. First step is we take the Flowcasted provisional dentures and under hot water, Taylor's going to follow me over here. Hot water. We are going to scrub with a denture brush the Flowcast. And then we're going to get some abrasive cleanser. I'm not going to tell you the brand, but we have some abrasive cleanser. And our goal is to get any stain or food or whatever stuck on it. Any areas where a buildup of even plaque. And then we're going to run it under the hot water. We're going to do the same thing on the lower. A little abrasive cleanser. Clean it up real good for us. I've seen dentures that have come in that have Flowcast in them that have got calculus on them. especially right down here in the lower anterior. So now that we've scrubbed it with an abrasive cleanser, we've run it under hot water. Step 2 is to dry it bone dry. And as you can see, as I dry it, it almost takes on an etched appearance. The nice thing about Flowcast, similar to Hydrocast, is that it sticks to itself, but to ensure that the Flowcast, the fresh Flowcast, is going to stick to the old Flowcast, we're going to paint the surface of the dried Flowcast with chloroform. And I just take a 2x2 sponge, wet it with a little chloroform, and what this does is it dissolves the surface of the Flowcast just a tiny bit. Chloroform is an organic solvent. I'll put that so you can really see that. And this will just ensure that my next little skim out layer of Flowcast is going to adhere. It already looks really good just from the chloroform on there. And so now what we're going to do is we're going to take one mix of Flowcast, which is 1 vial of liquid and a vial and a half of powder. We're going to mix it in this little jar, and I'm going to show you how to put it into the dentures, and then I'm going to run into the room and put it in Miss Reed's mouth. Let me show you exactly how I'm going to do this. Wood now. I'm going to mix it, and the material is going to be almost water. Very, very watery. Kathy, if you want to hand me a paper towel. Just very watery. Look at that. It's almost like skim milk. What this is going to do is any little imperfections or little places where salivary glands have made a little divot in the dentures, it will just fill it in. And Dr. Turbyfield used to use the term a gossamer layer, which means thin, thin, thin. I'm going to use my gloved finger, and I'm going to dip it into the Flowcast, and I'm just going to paint the surface of the old Flowcast with this new Flowcast. And we're going to use it right away. We're not going to let it set at all. It's going to set in her mouth. I'm going to do the same thing in the lower. I'm just going to paint it with my finger and let it flow down in there. And Kathy, I'm going to have you go put that in Miss Reed's mouth and let her close down. And I'll explain what's going to happen next. Thank you. Now we're going to put that in Miss Reed's mouth. Only a tiny bit will run out, and we'll just clean that off. But what this is going to do, it's going to just resurface and give us that perfect, fresh layer of Flowcast. We didn't put it in any jig or anything. And she's going to wear it until next week, because we can't actually pour a cast into the Flowcast for 24 to 48 hours. So this is Thursday, and what she'll do is she'll probably come back Monday or Tuesday, and that gives us time to make her duplicate dentures in the jigs we made before we refreshed. So refreshing is critical. Now let me ask you this. Why don't we just give Miss Reed back her old denture and let her wear that while we're making the finals. Well, I learned this the hard way, kind of like I learned everything in life. What I learned was if you give them their old denture back, it's going to beat that tissue down, and it's going to be rocking and rolling in their mouths. And when you get your final denture back to put into their mouth, it's not going to fit as good. And you think, what have I done? Well, you beat the tissue up again. And so that's why I use a flow-casted duplicate that keeps the tissue healthy, maintains the vertical dimension, and gives them a spare long term, so that when I put my final denture in, it's not a huge difference, and it's rock solid when we put it in there. So don't forget this step of refreshing in the finalization process, because it's critical to the fit and the success of the denture. Thanks.